I think that my internship location was a very good experience for me. Not having worked in a high school before, um, and just not really used to the high school setting, having not been over here and experiencing going through high school in America. Um, I was very skeptical going in, but after being there for 3 weeks, and I'm going to be there for for the entire fall semester. Um, I have already changed my opinion on what the high school setting is like. Um, for my location, which was at Terre Haute North, um, there were many strengths to this location. They have great staff, all willing to listen to what you have to say, all willing to take on board what you have to say, and all of them willing to look after the athletes first rather than thinking about winning first, which sometimes is difficult, especially as you get towards the college level. Coaches tend to be more strict and get into more incidents with their athletic trainers, but so far, from what I can gather, everyone is on the same page as us, which is great. Um, the athletic training room for a high school has a lot of stuff. Um, they just gotten two brand new Normatechs, which has added to the athletic training room, and the athletes seem to enjoy using those, and I think it's helping them as well. In understanding recovery um, as they get older, but overall, the location of my internship has been very good and very enjoyable. Um, and I don't think I'd have wanted to do it at any other high school other than Terre Haute North. Some of the weaknesses and maybe areas for improvement of the location. Um, Obviously, I've been at two colleges so far, so their equipment's slightly newer. Um, so getting used to the older E-stem machine, the older ultrasound machine at first was difficult, having only practiced on the newer ones. So I had to get used to that. But other than that, there wasn't much wrong with the location at all, really, and I really enjoyed the past 3 weeks working there, and especially with Greg, who's got a lot of experience. I've learnt a lot from him already, and being able to take some of that stuff, especially rehabilitation wise, looking at some of the stuff he does with his athletes, and then trying to use that with some of the athletes I'm working with. I think that Greg has also given me the opportunity to do a lot of evaluations. I think in the past 3 weeks I've probably done more evaluations on people than I had the entire last year, which is great, and I've really enjoyed that. Obviously, we don't like to see people get hurt, but from an experience point of view and learning, it's been great. And it's not just ankles, it's been wrists, we've had shoulders, we've had knees, so it's been a full body evaluation experience, which has been great. And getting back into the swing of things, I don't think my preceptor realised we hadn't really done much over the summer. So for me, to get back in there and get straight back into things, it was really, really good that he kind of gave me that free rein to do evaluations and then go and tell him what I thought it was, and then he could check on it. But with a high school, there's so many kids coming in that you have to be quick with your evaluations. So like not being able to take notes throughout the evaluation like you could normally do if it was at college level. So yeah, it's been a really good past 3 weeks working with my preceptor, and I think the rest of the semester is going to go so well. I think we get on really well, and I'm looking forward to see what the rest of the semester holds. Weaknesses for my preceptor, I can't really say I have any as of right now. That may change in a couple of weeks or so, maybe as the semester gets on, but he's very open to me coming up to him and talking to him about things, and he's always willing to answer questions. I can't think of anything weakness-wise as a preceptor he has. I've also been working with Jordan as well, who has been fluttering between north and south, so he's also been helping me, and me and him get on pretty well, and we've covered football game, like JV and freshman football games, and just asking different kinds of people the same question and seeing their answers and seeing how they do their patient-centered care and how it's different, because Jordan's a lot younger than Greg, so there's a difference in the way that they go about things. For future students, I'd just say enjoy the experience. Go out there, enjoy being there, have a good time, and you'll learn more if you're having a good time. I think the internship experience over the pre-season is something that everyone needs to get, because you have so many athletes covering, even if it's just one sport, but you're covering a lot of athletes, especially at the high school level, from all different types of sports, and it really is a great experience throughout the pre-season. Opportunities that I wish I had maybe had at this site, there's not really many opportunities else I could ask for. I was able to do an on-field evaluation. I had to spine board someone, which obviously you never want to do, but sometimes you have to do it. It's part of the job. So experience-wise and opportunity-wise, I've been given everything I could have probably wanted to be given. I was involved a lot during the spine boarding process due to it being just me and Greg as at the game. During a soccer game, I got to do an on-field evaluation for one of the other team with her knee. So that was a good experience, being able to go onto the field, do my evaluation quickly, and see if I could get her off the field to then do further testing. That was really good for me, and I feel like that went really well. And then just so many patient encounters. The opportunities have been very good, and there's nothing really else to add to that. But overall, the experience of being at Terre Haute North throughout my internship has been very enjoyable, and I feel like I can take a lot from this experience, which I think is the most important thing.